Hello, everyone. For those who have been the strongest one, and dear organizers and participants and professors also, it's my pleasure to be here present today and take part in this conference at the University of Catania. My name is Laura Kadile. I'm a lawyer in health law, and I'm also a PhD researcher at the University of Latvia. And today I would like to present the results of our research together with marvelous Dr. Marina Loseviča. It's a pity that she was not able to be here today, but I suppose she's watching us right now. So therefore, greetings to her. And I would like I would like to invite you to more specific research topic, I would say, and that is related to health law, public health as well, and the issues regarding the healthcare also during COVID-19. So for the introduction, we need to highlight that the right to health imposes 4 essential standards on healthcare services. Those are availability, accessibility, acceptability, and quality. This is also called the AAAQ framework, and it is set out in the United Nations Committee on Economic, Social, and Cultural Rights General Comment number 14, that already my colleague Julia highlighted recently in Article 12 this time. Just shortly, availability of services requires that public health and healthcare facilities are available in sufficient quantity, taking into account a country's developmental and economic condition. Accessibility refers to the health system that has to be accessible to all, especially the most vulnerable ones. Acceptability requires that health services are ethically and culturally appropriate. Last but not least, quality requires the highest quality of the health services provided. These standards are particularly important given the fact that demand for healthcare services is increasing. And one of the reasons is, of course, COVID-19 pandemic, when it became evident that healthcare is a part of national security. And therefore, providing essential healthcare is a state administration task. And therefore, incorporating human rights protection and safeguards into our shared responses is essential to successfully address public health challenges. Secondly, the reason for demand is so-called defensive medicine, the practice of medical care being a tool to reduce the risk of patient dissatisfaction and threat of medical liability. As long as healthcare providers are paid for the quantity of the delivered service, so to say, fee for service, rather than for quality and outcome, overall public health is at particular risk. According to the, regarding the violence, so healthcare in any country and healthcare system has to guarantee to be safe for both healthcare practitioner and the patient. And healthcare workers and support staff have the right to enjoy the right to a safe environment, just like employees in any other industry. From the patient point of view, it must be guaranteed that the patient trusts the physician and is willing to return to receive services based on this trust. And in spite of previously mentioned incidents of verbal and physical violence remains a worldwide concern. And this issue, these issues, for example, are outlined also in Latvian statistics, which record only physical cases of violence in mental health settings, for example. And there is no data regarding other forms of violence that may occur during daily medical practice, like verbal or psychological, including institutional violence. In addition, the question arises whether the protection of the physician's rights or the patient rights should prevail. And where is the boundary between protection of patient rights and the necessary protection for healthcare workers? Recently, European medical organizations issued a statement reaffirming that safety at work is the key for the provision of quality healthcare, highlighting the need for an effective reporting support mechanism for victims of violence, the implementation of violence prevention programs, and the enforcement of existing laws on violence against all healthcare professionals across Europe. Social media in Latvia has been loud regarding violence by physicians during birth, sexual abuse during examinations, raising voices in day-to-day basis even, and etc. If we look at the international legal framework, we see that the patient has always enjoyed privileged legal protection over the healthcare professional. And fundamental patient rights instruments are regulated in a range of international legal frameworks, including conventions, declarations. And therefore, the legal framework based on fundamental principles of patient rights, first of all, internationally lays down legal protection, which is then incorporated in national level. Regarding the safety for the patients, every medical institution, not only in Latvia, but this presentation is regarding Latvia, was ought to establish and maintain an internal patient safety reporting learning system. And this system should provide the collection and analysis of patient safety incidents to prevent their occurrence. And in reality, injuries occur during the hospital stay, for example, as a result of fight or self-harm, are not coded and reported at discharge. So they are unavailable to record, establish certain statistics, or find ways how to improve the system. The World Health Organization has also recognized the next decade where we are at right now, as the decade of patient safety. But so far we can conclude that the aim is far from being successful, in line with established practice in Latvian healthcare institutions. Just a short introduction within the adoption of UN Convention on the Rights of Persons with Disabilities that we were speaking also today. In 2006, there has been a fundamental paradigm shift from an understanding of disability-centered approach to an approach that respects the full and equal rights of persons with disabilities. And the human rights approach, which we also heard from my colleague Julia's presentation, requires to ensure that persons with disabilities can enjoy the rights to consenting to or rejecting medical interventions, for example, on an equal basis with others. In circumstances where the decision-making capacity of the patient is limited, it is necessary to provide special protection of such patients and their rights, especially during pandemic. It will be indeed written in the article that we sent and prepared. But although the legislator, that's very specific, but I need to say that although the legislator has already implemented the reform of the Institute of Legal Capacity in 2013 in Latvia, so far no new legal doctrine has been developed for determining a person's decision-making capacity. That's the capacity for health-based, the decisions that we take in healthcare in daily life. That's a prerequisite for decisions in healthcare. And moreover, the previously mentioned human rights approach says that limited decision-making capacity requires special protection of such patients, a person's overall, and their rights, including supported decision-making mechanisms, which is also very specific, but the main principles you already heard today, and not only from my presentation, so just only highlighting it. And here, just a quick numbers of, for example, incapacitated patients in Latvia that is growing. These numbers are not from the statistics in Latvia. I need to highlight it. We are researching it right now in my research group together, we're also with Marina. And but we can see that the number is growing, and we need to find a way how to protect these patients and persons overall. So may I conclude that the necessary support mechanisms to ensure the protection and safety of persons with limited capacity and to guarantee their autonomy need to be put in place. Therefore, patient-centered care standards, clear care goals, and standardized evidence-based measures of healthcare quality has to be developed. And healthcare principles such as patient safety, staff safety, and dignity in the workplace, public trust in healthcare, and legal awareness of medical staff, protection of the rights of patients with limited capacity, and value-based standards of care need to be strengthened. This research is prepared in the framework of these research projects that you can see. And thank you for your attention.
Do we have any questions from the audience here or online? Please go.
Please, Margherita.
In your sanitary structures. There is a national program that you can apply in all the hospital on the or sanitary structure, or you have a local intervention decided by local decisions makers.
Thank you for the question. I just wanted to ask more. Indeed, is it regarding the quality indicators, you mean? There's a problem that we do not have any system how to assess even what the patient thinks, how he decides, he or she, or even a person. There's no system. It's not regulated in legal regulation, legal framework. There's no legal framework for that. So what is the basis of assessing something? Yeah, is it only our own values, emotions at that day from a healthcare practitioner's side of point of view? But the praxis is on the basis how the quality and how the quality indicators are being collected right now at the healthcare institutions. Yeah, and therefore the aim of the study is just to highlight the need of such system, of common ways, common practices, how it should be implemented in the praxis and in healthcare institutions, and more precisely in psychiatric settings, in mental health settings. That is different question. Of course, it is not that much a topic that we can go in more in depth during this conference, but I just wanted to highlight that we have this pretty much the same principles that we heard from my colleague Julia. We're together also in Ghent. There was a European health law conference where we met. So we can see that the law goes through every question. So I'm very happy to be here as a lawyer, and if we have any ideas for any research, in future, we can move the conversation a bit later.
Thank you very much.
Thank you.
I have also
Yeah.
just quick question, but maybe we can also discuss later. You mentioned very intensely the role of COVID in shocking the health system in a way, pushing through transformation, no? And so my question is on your vision and also on your studies, which has been the effect in terms of quality of COVID? Because of course, COVID shocked and pushed it to reshape, but the quality has been like affected positively or negatively on how there was like the effect.
Yeah, thank you for your question, Domenico. I actually presented my research in Ghent, Belgium, at the European Health Law Conference this year in April regarding the assessment of decision-making capacity for patients during COVID-19. But the main principles have not gone anywhere. Yeah, that's the first point, that even if there's a pandemic, a COVID-19, we should just not skip the general principles that we use in everyday basis, being a lawyers and being beside that legal regulation. But of course, the main question still exists. Where is the need to implement some sort of regulation in order to protect the public health? That's basically the two questions that I already raised during my presentation. Yeah, where we can see a patient from as an individual, and where is the protection needed, and where the protection of an individual starts, ends, and where the protection of a public health starts and ends. Yeah, and that's of course a global issue, and we can see how active worked till during these 3 already COVID years. For example, Germany courts, constitutional courts regarding these issues, or regarding vaccination. But vaccination is not the only issue during the COVID. And there are the values and the principles that I already mentioned, that we mentioned even in each of us in our research area, remain the same. And basically, yeah, and that's still, that was a quite crucial experience to follow the judgment, the conclusions in all of these judgments, also in Germany, and they are now coming more and more also in Latvia. Still quite few, but very interesting also from a lawyer's perspective. So, but that's a big question to open up and even organize another conference for that. Thank you.
Thank you very much.